question, the member from Newmarket-Aurora.
To the Minister of Health. Speaker, here's what the president of the largest provider of fixed-wing air ambulance services to Ornge told the Public Accounts hearing last Wednesday, and I quote, "Questionable and unethical business practices still exist at Ornge," end of quote. Allegations of inherent conflicts of interest, coercion by Ornge senior executives of proponents during the bidding process, little, if any, operational oversight by Ornge of its private sector aviation suppliers, and, Speaker, no requirements whatsoever for proponents to prove that they have the financial capacity to deliver on their contractual obligations.
Question.
Speaker, I ask the Minister of Health, are any of these revelations about what is going on at Ornge today under its new executive of concern to you?
Thank you.
Or will you simply accept them as...
Thank you. Minister of Health and Long-Term Care.
Well, thank you, Speaker, and I can assure the member opposite that Ornge is taking these allegations very, very seriously. They are investigating them. I think it's important to understand, Speaker, that Ornge is into a new chapter, and we are seeing the evidence of that, Speaker, in that their commitment to put patients first, Speaker, to enhance transparency and accountability. They value these principles, Speaker, and they are acting on them. Speaker, I think it's important to acknowledge that our frontline staff at Ornge put their lives at risk every single day, making sure that people get the care they need. When patients need to be transported, Speaker, the people at Ornge are there.
Answer.
So, as I say, well, Ornge is taking these allegations very seriously and is looking into them.
Thank you. Great.
Speaker, that's precisely why we're concerned about this, because we support those frontline people at Ornge, the paramedics and the pilots and the people who are doing the frontline work. What we're concerned about are the allegations in the executive suites of this organization that suggest that there's conflict of interest that's rampant. We're told by Mr. Rick Horwath, the president of Air Bravo, that the president and CEO is fully aware. We were told that the chief operating officer confidential emails to be distributed to his competitors. Speaker, this is the executive suite of the executive suite that the minister assured us was being cleaned up. We want to know, will she order an independent investigation of what is going on in the executive suites at Ornge? Will she confirm that for us today?
Thank you. Be seated, please. Be seated, please. Thank you. Minister of Health.
Speaker, as everyone in this House knows, there is new leadership in place at Ornge. They have impeccable credentials, and they are working very hard to ensure that patients who need Ornge get the care they need. Speaker, I'm not the only one who thinks that Dr. McCallum is, in fact, an excellent leader. I have a quote here. I think that Mr. McCallum, or Dr. McCallum, brings a brand new perspective to openness and transparency. Precisely,
Order.
That quote is from Frank Klees on March 20th, 2013. So I know the member opposite has a great deal of respect for Dr. McCallum. Let's let him do his work.
Thank you. Your question.